Hello, my name is Michael Forster. I am a professor of pharmacology and neuroscience here at the University of North Texas Health Science Center. And right now in our laboratory, we are interested in developing drugs to treat addiction. Specifically, we work with a government-sponsored drug discovery program. It's known as the National Institute on Drug Abuse Addiction Treatment Discovery Program, the ATDP for short. The mission of this program is to identify and then evaluate and then recommend potential pharmacotherapies that could be used in the medical management of substance use disorders. And the focus is really on all substance use disorders. Our laboratories are a national site for the first testing of potential new treatments for addiction. The new drugs come from a variety of sources. They come from the pharmaceutical industry. They come from the National Institute on Drug Abuse's intramural research program. And they come from other scientists at institutions nationwide that are funded by the National Institute on Drug Abuse. In our lab, we use different rodent models. These are models for drug intake, and we know that animals actually like the same substances as humans. And our team, using the rodent models, can identify substances that would reduce drug taking and could prevent relapse in individuals who have sort of already recovered from addiction and are currently abstinent. So we expect to be the team that identifies at least one medication for recovery from addiction. This would be very exciting. Thus far, several drugs in the NIDA program have gone to clinical trials, none of them that successful. Additionally, we hope to understand the phenomenon of drug-associated memory, which is a key, we think, to developing drugs that would help recovery. The drug-associated memories are stronger, and they're more long-lasting than normal memories. They're also less specific. For example, some drug memories actually move backward in time, and normal memories generally are moving forward in time. Drug taking causes these associations, and these associations unconsciously cause us, or I should say addicts, to seek drugs long after recovery from addiction and withdrawal symptoms. We have a theory as to exactly how these strong memories are formed, and we have identified actually a drug that may selectively block retrieval of those memories. Strong memories of drug taking are a characteristic of all drug classes. And so this drug that we've developed to facilitate recovery could be effective for different types of addiction.